Hi, folks. Today on Infertility Sucks, I'm going to be discussing good cervical function, which includes your cervical mucus and your cervical glands, which make the mucus. In my introductory video, we discussed kind of the whole picture of what I'm trying to teach as I guide through infertility to coax your body back to a reproductive state of health. And then I followed that up with a food and digestion video because first, before anybody conceives, there's got to be some good digestion going on to facilitate nourishment to your ovaries, your cervix, your cervical glands, which make your mucus. So today I'm going to kind of zero in on the cervical, your cervix as a whole, as its own little entity, and what it needs to be well nourished. And first, it needs that good digestion, as I said. It also needs a good dose of B vitamins, and namely, I'm speaking of folic acid. Sometimes we always hear about folic acid being in prenatals, or it's really good when you're pregnant, but it's actually really good for your cervix to prevent cervical cancer, for one thing. And it's also great before you're pregnant. Do use it before you're pregnant. If you're working at becoming pregnant at all, even if you're, maybe engaged to be married or not, in a relationship, you want to keep your cervix healthy anyway. But especially if you're trying to conceive, you need that folic acid. And folic acid needs to be digested well. And the precursor to digesting folic acid well is hydrochloric acid, which is in your stomach. Your parietal cells, which I explained in the digestion video, create strong hydrochloric acid, and as you age, those cells become less vibrant and don't have the potent power they once did to create that strong acid. If you can think for a minute when you eat and the feeling of tiredness you get after, that's because digestion is the absolute hardest thing your body ever does for you. Breaking down all of that food requires your parietal cells to work really hard and get strong acid out to pulverize the food, pulverize the minerals, pulverize the vitamins, make them minute so that it can get out to different areas of your body. But right here we're worried about the cervix, and folic acid needs that strong hydrochloric acid, which as you age, I said, kind of diminishes. So as an advanced maternal mom, what you can do, or mom to be, what you can do to increase your digestibility, especially for the folic acid, is take digestive enzymes. You will find that in the health food stores, the digestive enzymes, I think the majority of them carry protease for protein digestion, amylase for carbohydrate digestion, and lipase for fat digestion. You don't see a lot of them, the formulas with betaine hydrochloride. Betaine hydrochloride is hydrochloric acid directly from beets. The beets, eat your beets, right? I think your mom probably told you that, or it's the beet. You can't believe what a medicinal food beets are. They cleanse your liver. They're powerful. They're medicinal, and they're just beautiful for you. And if you can get betaine hydrochloride in a supplement for digestion, that's going to be the way to go. Look for that. If you're having trouble finding it, I can get it for you. I can get it through Now Foods. If you look for a Now Foods digestive supplement, it's called Super Enzyme. And that's the one I take now, even because I'm 54 and I want to digest well as I age. So that, with meals, along with some folic acid and a B vitamin complex, will nourish your cervix and your cervix glands really, really well, and ensure that gets out to your body. So your glands, the cervical glands, once they get the folic acid and are able to function well, you want to look, as you've been doing this over time, you want to look for some nice slippery egg white type of mucus, where it's really stretchy, nice and clear, slippery. I mean, you can obtain it from your cervix, and if you don't know how to do that, you kind of just go in digitally with your 2 fingers, and if you're wondering how that would feel, you go in about 4 or 5 inches, and you will run into your cervix. It feels like the tip of your nose. And you can kind of go like this, just gently, and that will harvest you some cervix mucus. And once you bring it out, kind of go like this. You want to see some nice stretch in here and nothing breaking, not a lot of cloudiness, although some does occur. You want it mostly clear. And that's going to happen when you're digesting food well, and the B vitamins, folic acid, and everything is getting to your cervical glands well. When you do digital checks, you also want to kind of place your finger in your cervix a little bit. You'll feel a slit, and that's the opening of your cervix. That actually will dilate and constrict depending on whether you're fertile or not. So say you're 40 something or 38, 9, late 30s, early 40s, and you want to kind of get a feel for whether your fertility is approaching, you can go in and at any time, and I mean, you probably wouldn't do it more than once a day, but you can go in and check the opening to see. You'll get to know that. You'll get to know your cervix, and you'll get to know if it's open in the least little bit. You'll be able to feel it. It might not seem that way, but you will get to that point where you're able to make that discrimination. So from there, if you start seeing those kinds of signs, as my dogs are playing, but if you start seeing those good fertility symptoms like that coming from your cervix, you're making some progress. So I just want to leave you with that, and leave you with some sprinkles of baby dust, and we'll talk to you next time.